You've had some 3 different community stories this afternoon, and then the presentations about what the international data says about Scotland, and indeed about international trends concerning adolescence and its the markers of health and well-being, but also about the drivers. So let's open it up for conversation. Comments or questions about it? You happy, horrified, upset, optimistic, concerned? Demoralized?
I think I've got a question about family meals.
Well, yeah, why don't we let the panelists ask each other questions? That's a great thing. John, go ahead, give us a question.
I'm really curious, do we know anything about the aspects of the family meal that is having this impact? What do we know about family meals that's making the difference, other than the existence of them?
I actually think it's just time. Yeah. I think there's only so many hours in the day, and if you're having a family meal, you're not doing other things. It could just be as simple as that.
Yeah.
Or, you know, by the time you finish your family meal, well, I know I'm exhausted. Maybe they are too. I don't know. But it could just be something as simple as that. We don't know, we haven't actually asked how many people are involved, or so we don't know too much. But
Kate, would it be fair to say that you're deliberately using the term family meal so that there's no judgment made about what is the family? Whatever they think of as their family is exactly the way you define it, right?
Yeah, I think the question is, do you have a meal, how often do you have a meal with one or both of your parents?
Okay.
So that's the definition we use. So it's not just you with your wee brother, or there's an adult there.
But the other group who don't live with their parents say that, you know, a lot of them say that they do so 4 to 6 times a week. So it could well be that it's open to interpretation a little bit.
That's good.
Yeah.
And this is clearly without reference to home cooking, which we understand is going the way of the dodo. Right, it's just eating together. That's what's important, right? Yeah. Okay, it's helpful. Other thoughts? Yes. All right, Graham. Yeah, be better, yes. So we capture you for posterity.
Just on that point again, going from an observational study like that, could you do an interventional study, taking families who don't have a family meal at the moment and studying them for a bit, and then introducing a family meal or encouraging them to introduce it, or is that just too mad?
No, I think that's a great idea. Would you like to fund it? I think it's a great idea. I do. I think it's a great idea. Yeah. I think the next step after this would be to do something a little bit qualitative, perhaps, to look into it a bit more, and then I think following that would be an intervention.
It does raise the question, though, whether a very poor uptake program in many parts of Scotland, like free school meals, should be changed to free family meals.
Mm-hmm. Yeah, that's a good idea.
You know, if we got better, we probably have better evidence there for this. Other questions or comments? Yes, go ahead back there. Is that the gentleman from the YMCA in Lanarkshire? I believe it is. Go ahead.
It relates to some of the things I was asking earlier on. It was interesting to hear that a lot of the work has been done in partnership, but there wasn't a huge reference to the third sector, and I think that's where we might be missing a trick. The third sector is plugged into the local community, already have relationships with huge numbers of young people and families, and a lot of the good work that is going on is because of the relationship they have with the NHS or the local authority. Is it an opportunity to build on the relationship that these organisations have to then tell the government what they should be doing, instead of the government working top down and telling us what we should be doing?
Anybody want to take that on? Third sector?
Yeah, maybe just to say in the work that we've done, and when you're standing up there with the light in your face, you forget to say a lot of things, but many of the people that came to our professional events and many of the professionals that we engage with are from the third sector, and have a good relationship with the people that we're working with, and we're building on that. So definitely that's a hugely important area, certainly for the NHS and other statutory sectors to build on. There needs to be more partnership in that area, but we are doing that.
Just to also add to that as far as Scottish Government's concerned, Scottish Government are very receptive, certainly in the field that
we work in and are really keen to learn and listen to the experience that's being had at local level, and that shapes and informs policy. So it's not just a top-down, bottom-up. It's something that we all benefit from in terms of a learning, of a virtuous cycle.
I think with the voluntary sector as well, having managed in the voluntary sector and worked in the voluntary sector for more years than I have done in local authority, one thing I always appreciated was, I think the voluntary sector's got more of a personality. I think the agencies within the voluntary sector have more of a personality that I think young people find much easier to engage with. I think voluntary sector agencies are much closer to the ground, whereas if you look at schools, you look at community centres to a lesser degree, but you look at the large local authority establishments, they're quite daunting and they appear very power-based. So I would always appreciate that contribution to the voluntary sector, and I don't necessarily see it as bottom-down, top-up. I'd see it much more as a dynamic where we're all discussing, we're all pulling together to find the solutions. Although having said that, I think if you are a voluntary sector agency, it can sometimes feel like you may be overlooked or you don't have the voice that you would like. So I can appreciate maybe where the question's coming from.
Can I just also say it was an oversight on our part also not to emphasise that in the Joint Health and Wellbeing Unit we do have a strong working relationship with third sector partners, and hope to extend and to build on that through commissioning pieces of work in the third sector. And also to say that the event that we had around gambling related harm was well represented by the third sector, and indeed some of the work, particularly through partners who are engaged in employability issues, the third sector organisations that were there were very much more receptive to the idea of looking at skills development in the first instance than perhaps other partners were.
I wonder if there was an underlying issue there that perhaps you were implying, is that are there enough opportunities for third sector and local authority or central government to interact, to even come up with ideas of partnering?
I think a lot, based on our own experience, it has relied on relationships we've built with public health teams locally. There's no strategic direction saying, yeah, this should be coming down to third sector or voluntary organisations. I've got a great relationship with the unit team leader and their public health team. We developed a sexual health service 3.5 years ago, and it's the most successful service in North Lanarkshire. We're getting 250, 300 young people coming out, although I don't know if that's a good thing. 250, 300 young people accessing the service a year, and it's only on one night a week. But that's relied on a relationship we built. There's no driver to make voluntary services engaged within that, and that's really my question. There should be more emphasis put on, is the NHS or our clinics the best place to be delivering these services? No, get them out, get them in the community, and people will access them. They won't go if they're stigmatised in clinics and things like that.
See, I'm really impressed that you get that kind of utilisation. You know, I can tell you that as somebody who ran a public health clinic for young people 33 years ago in Canada, it was perfectly evident to us then that if we wanted to see people with concerns about pregnancy or concerns about birth control or concerns about sexually transmitted disease, they were not going to go to the GP. So I'm not sure why it's been so slow to take on, but you're clearly in the lead. Does anybody have a comment about that?
I probably reflect the model across the Lothians, where we recognise that clinical services are very daunting for anyone to step over the threshold. And through the Healthy Respect Network and through C-Card, which are powered by the NHS, but it's through partnership with voluntary sector, local authority, school nursing, we've put drop-in services right out at grassroots level. And young people will decide for themselves if they want to cross that threshold, largely based on the relationship they have pre-existing with whoever's working that drop-in before they come to the drop-in. So those drop-in workers are getting out to the schools, they're getting out to the community centres, they're building really informal relationships so that young people feel that they can walk through the door and start to access services. And if they need something more than that fairly basic drop-in service can offer, well, there's the gateway. There's the gateway. So absolutely, it's a classic example of where the voluntary sector and where some of our community-based services are absolutely critical. Yeah.
Anybody else on that topic? Good, thank you for that comment. Yes, Hillary. Oh, it's right here, second row.
My name's Hilary Campbell. I work for an organisation called Gay Men's Health, and I was just interested in I can understand that there are gender differences, that there are social economic differences, there are a whole range of factors affecting risk-taking behaviour, but I would like to make a plea to agencies, researchers, that young gay men are a particularly vulnerable group, and they do indulge in risk-taking behaviour, and that new HIV infections in Scotland, the most single significant vulnerable group is gay men, and that where possible, cohort studies or other research takes account of the vulnerabilities, low self-esteem, mental health, bullying, and all those other issues which young gay men are facing.
Yeah, thank you for that. Does anyone want to comment? Have any program experience?
Just to say that I entirely support what you've said. In Tayside, we're just finishing and about to publish a needs assessment with gay and bisexual men, and that's one of the key issues that's come out, is about how vulnerable young gay and bisexual men are, and that we certainly would be looking to the feedback from those young men to shape how we deliver services in the future. And I know that across Scotland you'll be well aware of some of the work that Health Scotland are doing around this, that I think will help improve that situation for young gay men.
Mm-hmm. Thank you for making that point, Hilary.
Can I just also say that in the workshops that I referred to in my presentation that I've done recently with young people in a secondary school who were second and third year pupils, that one of the unexpected outcomes from those workshops was the really, really strong gender stereotyping views that there were among young people of that age. And we had a girls group and a boys group separately, because that's what the school offered us, really. And I think that for a young gay or bisexual boy in a school, it would be very, very difficult for them to step forward and ask for help or to find support anywhere. I think that they would have to keep their issues very hidden, and that would be very isolating. So I think that you've got a very good point.
Mm-hmm. I think within the schools environment as well, Curriculum for Excellence has really put this much more centre stage than previously it had been. In the primary schools are really having to take this agenda on now in a much more explicit and much more normalising way. They're really having to get their heads around how to challenge homophobia and homophobic language. So it's about challenging the discrimination and nipping things in the bud at a young age, as well as providing services that are really bespoke and really speak to the needs of the young men that you're speaking about. Because I think you're absolutely right, and we can't overlook that.
It's cheering to hear that. I have to say, if it's anything like Canada, that would be true in Toronto as it is in Edinburgh, but it would not be true in a rural area or a small town. So it's still
diverse.
Yeah, it's very diverse. Yes, go ahead. Oh, Renee, it's about I don't know, fifth row from the back there. You want to just put your hand up so she can see where you are? Yeah.
Hi, I'm Christine Wallace, NHS Lothian, and I was just picking up on the demonstrated benefit we talked about, this kind of schools connectedness, or young people's connectedness to schools. I just wondered if the panel had any thoughts of how we can support schools in this, perhaps potentially when things might get worse, with sort of unemployment and young people leaving, with bullying and exclusions and things. So just really looking to the panel for any suggestions how we will be able to support.
Panel?
Pass.
Felicity, you?
I think that it's schools are this fantastic resource for us in many, many ways, and I think that by working very closely I know we keep using this word partnership, but so much can be gained by working with staff and working with the structures and working with the young people. And I know Tayside has had a programme of different interventions working in schools and working with young people and looking at health issues and giving young people the opportunity to ask questions. And I think we have to build on that, build on those relationships and keep those avenues open for discussion. I don't think things are getting easier for young people at school, and as somebody who works on the Cool to Talk website, you know, we see that emerging, the stress and the pressure on young people about friendships and exams and peer pressure and all these things. So I think it's really important to keep acknowledging that and keep looking at ways, but also maybe to go back to the evidence base that looks at intervention in early years and start right from the beginning.
Sorry,
I see some more questions. Yeah, go ahead, Ruth.
In the literature I was talking about this morning, they were talking about this idea you're saying school connectedness, and one of the big things that it was about was schools being respectful as well. And I suppose it's like a whole school approach that doesn't actually require any money. It maybe just takes a shift in values and making pupils actually feel part of the school and feel respect. So it's like a whole school's approach. And I think the SEED trial that I was talking about, the one in Glasgow, one of the things they were doing was trying to affect the whole school policy towards children. And so it's not about specific classroom interventions that take teacher time. It's just about having school policies that are respectful to pupils and make them feel valued.
And is there something about young people's connectedness with the primary school versus the secondary school that can give us some answers? Because I really feel something happens at that transition which really doesn't benefit young people. And I don't know if it's about age, I don't know if it's about a change in circumstance in the broader community, or whether it's something indicative with the school environment. But, you know, going back to what we were talking about a second ago with homophobic bullying, a massive escalation in incidences once you tip over into the secondary school environment. So I think some of our answers around school connectedness, I think we've got some questions there around which schools we're talking about, whether it's primary school and secondary school, and what's happening.
Candice, you have a comment?
One of our colleagues at Carew is doing work on the transition between primary school and secondary school, and one of her PhD was on this and the impact of that change on mental health and well-being. And her research suggests that it's the breaking of very important relationships and a lack of connection between the primary school and the secondary school to nurture the more timid child through that transition that causes such mental anguish. And one of the interesting observations in our international studies, that some of the countries have a tradition where children stay with the same classmates from primary right through secondary school. So there's incredible continuity in relationships. And I think that's something that we really don't take much acknowledgement of, is this massive event that the change from primary to secondary can be, and how long it takes to recover from that. And being the youngest child in the school from having been the oldest can be quite traumatic. So I think there could be some really quite simple change in practice around that.
Yeah, it's very ironic if you remember the reason we have very large secondary schools and much smaller, typically, primary schools, has to do with a different era. It comes from an era when lots of people didn't go on and certainly didn't finish secondary school. And secondly, we thought we needed specialized facilities for technical education and for phys ed and for musical education, art education, which wouldn't be efficient or possible at the local level of a primary school catchment. Now, all of those things are arguably no longer the case. So you might actually say, and this is interestingly one of the things purchasable by the wealthy in Scotland's private system, is that you get to purchase small. And many of the schools that are private are actually selling you a much smaller secondary school experience. Go on, comment?
I was just going to make a very similar observation. I mean, one of the really stark differences is obviously in terms of size between primary school and secondary school. And maybe there's something in that we could preserve some of the smallness by almost having sort of units within schools. Like often in the independent sector, you have houses which people identify with, and gives them that sense of connection that is very difficult to have a sense of connectedness if you're part of a school that's 1,000 pupils plus. So there's maybe some learning around that. The other thing I think about positive school ethos, it's coming about seeing the importance of pastoral care as well as academic attainment. And that comes from leadership, and leadership at all different levels of the school. And certainly, there's so much to talk about today that we can't even scrape the surface, but there's quite a lot of work that's been done around positive school ethos and the impact that has on outcomes for children and young people. And I think there's probably a lot that we can learn from the literature around how to actually bring that about.
Yeah, interesting. I saw a hand at the back there. Yes, go ahead. There's one here too, if you want to go around this side.
Hi, I was just wanting to respond to the point about school connectedness myself, and I know that I'm not a member of the panel, sorry. But I was going to say, engage your partners around the school in order to get the young people who are having problems and who are therefore more likely to engage in risk-taking behaviours. Use your partners that you've got and see if you can get them to help the young people have a bit more belief in the education system and build up that value in the school connection again.
Optimistic view for sure. I see a question here, and then there's a person that I've been trying to get a microphone to over here. Go ahead.
Yeah, it's just a question around lone parents and what you were talking about. I was wondering if it's been correlated with deprivation, because we know obviously if you live in deprived areas you're more likely to be involved in risky behaviours. Also, there are more lone parents in deprived areas relying on one income and more likely to live in less well-off areas. Earlier research was shown us that domestic abuse also leads to an increase in risky behaviours for children and young people. But then if they leave that situation, then they're putting them into another risky situation, being a lone parent. So what I was really wanting to know is what it is it about lone parent families that puts them more at risk? You imply that it's a lack of connectedness and that's why the family meal can reduce this impact. But anecdotally, often from my own experience, I know many children feel very close and they have an extremely close bond with a lone parent, perhaps even more so than in traditional families.
Mm-hmm. Comments on that, anybody?
Well, we did adjust, if you're talking about the family meal, we did adjust for family affluence, but we didn't adjust for socioeconomic status at the area level, so it could be something that's happening at the area level. But what's happening for young people of, well, it wasn't just lone parents, also step families weren't doing too well either. But although they might feel connected, the actual transition that they've experienced from living, not that everybody that's got a lone parent has experienced a transition, we can't separate it out from the data that we've got, but if you could maybe see whether it was the transition that's caused it or some kind of complicated living arrangement whereby they're still dotting around to a second home. So that there could be a few things there that we haven't managed to capture. But what it's probably not is affluence at the individual level, at the family level.
Mm-hmm.
Just very interesting.
I think this is... Oh, go ahead.
Sorry, just wanted to add that maybe in the work that we're doing, that's why it's so important to start with people's own experience and their reality. Like the young mothers that I spoke to who said, you know, I'm a young mum and I'm a good, and I work hard and I love my children. You know, why does that make me at a disadvantage? And so the data may say one thing, but people's experiences might be quite different. But then, you know, they went on to say, but actually if I had to do it again, I would wait till I was older. So it's about working with real lives but you know, we know what the facts are and then we support people in real life situations. And I think that's really important. And I think it goes back to what Harry was saying this morning, that we have to work more like that and take the data and the evidence obviously as a backbone, but recognise that real life is actually much broader and we need to work with that.
Thank you. Okay, now we can get your question there. There she is. I'm going to give her the mic. Thanks.
Julie Gordon, Greater Glasgow and Clyde Health Improvement in the North West sector. I wondered if I might ask the panel and the researchers if anyone has examined the contribution made to the positive outcomes for young people and their connectedness by their engagement in activities such as sport, drama, music and hobbies. And I'm just thinking back to the comments being made in the panel really around what happens in the independent sector, and while a lot of that has to be purchased, I can't help wondering if there's some lessons there around what we might be able to provide out with that independent sector that actually doesn't cost money, thinking around things like compulsory sports on a specific day, etc.
Comments, Pam?
I'm maybe not the best person to answer the question, but certainly when we looked at the evidence around what was working around addressing teenage pregnancy, the two key themes that came out were early interventions in early years, but youth development work that built self-esteem, self-confidence, valuing themselves and aspirations for the future and expectations for themselves. And what came out from the evidence from the US was exactly, it's about experiential opportunities that we can give to young people around, volunteering, peer-led opportunities, vocation opportunities to spend time giving something back themselves to their own communities. And there's lots and lots of opportunities that we could support within communities if we give people the chance to do that. And I think it's just about supporting communities to come up with those sorts of opportunities themselves. A lot of the things don't cost a lot of money at all. It's just that we need to open the doors for people to let them do those sorts of things.
Mm-hmm. Is it a question that's, can I ask Candice, is it a question?
Yeah, it's certainly, there's been a module of questions which we're looking at social capital, which some countries can add into their questionnaire. And my recollection is that particularly volunteering has strong links with well-being for young people. Being a member of a club, being a member of a group, a formal group rather than just an informal group. And on the other side, children who are just out in the evening tend to have a whole host of risk behaviour clustering. So I think the message is pretty clear from our data that young people who have opportunities to engage with other youth outside school, either in a voluntary setting or through sport and physical activity, definitely seem to have benefits both for risk reduction and mental well-being. And as you said, not all of those need to be necessarily things you pay for, but there's definitely an SES relationship between physical activity and family affluence. So we know that children who are from more affluent backgrounds are tending to get better opportunities to take part in physical activity, which is a bit of a worry, given that that is one of the areas where Scotland's doing least well, and there's a real differential in terms of wealth. Having said that, another project we have has been to evaluate the programme Fit for Girls. And one of our PhD students has been doing an in-depth study of girls' responses to the PE experience. And it's not necessarily something you can force, and they're very aware when it's being forced, and they're also very aware of the differential for girls who are not very sporty and how that disadvantages them. So it is once again quite a complex picture, but I don't think it's simply a matter of money in all cases, but it's definitely, if young people feel they've got a place to go and an activity to be involved in, they seem to fare better.
I just remember in a previous presentation you indicating that if a young person had 4 or more evenings a week at their own disposal,
yeah,
it's higher risk.
Definitely.
There's a kind of a message there for local councils, isn't there? Which is, as we make the cuts, as the cuts are made, as is happening, if they cut support to public and therefore low-cost, easily accessible recreation facilities, the children of the rich will still find places to go, but the children of the poor won't. So I think it's an excellent question. We run a bit over time. I want to thank the panel. I think they were fantastic. Thank you. And I want to thank the people who made this day possible. Our 2 co-hosts from NHS Health Scotland, Emma Hogg and Donna Milne. Are you still here? Yeah, thank you. at the back. And our two staff, Renee Ingram, who's just got the mic there, and Sam Bain, who may no longer be here, but was here this morning, and Ruth as well, who helped very much with today's events. And thank you for coming. And again, if you want to have more to do with our adolescent and young adult working group and come to our meeting on May 23rd, stop at the table and leave your contact information, and we'll make sure we get in touch with you. Thank you.